E of the South Carolina Code of Law. First thing on the agenda is the minutes.
Mr. Chairman, motion to approve the minutes of the May 13th, 2021 meeting as presented.
Is there a second?
Second.
All those in favor?
Aye.
Okay.
Yes, sir. Thank you, Mr. Chairman. Members, good morning. Good to see everyone in person. Been a busy month at the agency, as always. Have a lot of staff doing a lot of great work. You might have noticed a Post and Courier article where they asked people, how much time has your staff actually worked on COVID? And we added it up. There's been more than 100,000 hours of overtime by agency staff working on COVID, and that's just what got reported. We know there's probably much more than that. So I just wanted to start off by thanking the staff, as we are moving forward and starting to see, I think, the light at the end of the tunnel in a positive way. They've done an amazing job, and they're a big reason why we've got here. And it's their great work, and not just on the health side, obviously they've done a lot of work, but also on the environmental side, where a lot of crossover work has been done, supporting the COVID effort as well. As I mentioned before, Keith Frost is on our environmental team, but also leading the incident command for the COVID response, and he's just one of many who are just doing a great job from all parts of the agency supporting the effort. So I wanted to start out by thanking them. And then moving on to that, as you may know, the final and the 30th actually, public health emergency order expired on Sunday, and the governor chose not to renew that. So we are no longer under an emergency order. From the DHEC standpoint, we don't think that's going to have a major impact on what we're doing. The funding doesn't change for us. It does change that there was a system whereby emergency responders could determine the COVID status of a place they were responding to. That was under the emergency order, but what we had seen is use of that had dropped off very, very significantly over the last month or two. So, and when we put this out to the emergency management departments at the county level, there was not much concern raised. It also takes away some of the expedited contracting we were able to do, but at this point we're pretty much using standard contracting procedures anyway. So again, I don't think that will have a major impact. We've certainly worked with EMD, Emergency Management Department, National Guard. We continue to work with them. This will not change that. They also, I think, we're fine with the order ending. So I think it was time. I think that's a very good sign that we are moving forward, and that we're now to a new phase of the response. As I said at the press conference on Monday, just because the emergency order has ended doesn't mean our efforts are ending. Far from it. We still have much work to do. Right now we're at about 38, almost 39% fully vaccinated of South Carolinians, and about 45% who have at least one shot. Obviously we want much more than that. We have a number of things that we're either about to launch or have launched to support vaccination efforts. We have the Shot and the Chaser campaign, where we've partnered with a number of breweries through the South Carolina Brewery Association, where, obviously you have to be 21, but if you're 21 and you get a shot from a participating provider at one of these breweries, you will then get a free drink. And that's proving to be popular because we're really trying to get younger people vaccinated. That's our weakest group right now. The very lowest number of people vaccinated is in our 20 to 26 group. And we think this is a good way to reach out to some of those folks. So that, I think, is going to be a positive move. We continue our Vaccines at Events campaign. We're going into a number of festivals and fairs and that over the next few months, since this is the season for those. And we'll have vaccine tables at many of those events. We're still working with the state parks to have vaccine tables and state parks, especially on busy days, and working with them at least some of the time to give free admission if you get a shot as well. So not huge incentives, but things that I think will help. And most importantly, just having the vaccine available where people are, and especially where younger people are, which is our number one target population right now. We've also now expanded our homebound program. You may remember we pilot tested a homebound program where someone would actually go into the person's home if they were homebound in 2 counties. That worked very well. So we've now expanded that to all 46 South Carolina counties and have contracts in place, and that program is now up and running. So very excited about that. I think that'll reach some of our highest risk folks that we haven't been able to reach in the past. So I think that'll be positive. And then we're also have a contract that will be closing soon to put mobile units across the state and make vaccine available almost street by street if we can, especially in some of the rural areas where we just haven't had much penetration. try and get vaccine to people there. Again, we want to make it as easy as possible for folks to get the vaccine. We're trying to overcome hesitancy with these efforts. Because again, if you're running to the table and you're at a state park, you're at an event, and there's folks, educated folks there that can answer your questions, you just might take the shot when you wouldn't have otherwise. So that's where we're at with the COVID response. Obviously, we're still running testing. We have a number of testing sites. The number is gradually going down, as you might expect. We're up to almost 8 million tests given now statewide since we started. And that's been very helpful, and we continue to do testing. And obviously, we have, as you can see, adopted the CDC guidance after our own review of the literature that folks who are fully vaccinated do not need to wear masks in most situations, either indoors or outdoors, with a few exceptions. We do still recommend that unvaccinated people wear masks. Obviously, at DHEC as well as elsewhere, that's on the honor system. We don't ask if you're vaccinated or not, but we do certainly encourage you to wear a mask if you're not vaccinated. And certainly, some vaccinated folks choose to wear a mask, and that's fine. And we very much allow and encourage mask wearing by all individuals at DHEC if they so choose. And again, and certainly for folks coming to visit us, same policy applies. If you're not vaccinated, we ask that you wear a mask. If you're fully vaccinated, then you don't need to. So that's where we are with the COVID response. Let me stop there and see if you have questions before I move on to a couple other agency issues.
Just one, Dr.
Yes, sir.
Zimmer, the 39%, 45% vaccinated.
Yes.
How does that compare nationally? Where do we fall nationally?
That is not where we'd like to be. I believe last I checked, we're 42nd, which is obviously pretty close to the bottom, which is not where we want to be. Now, I will say that our numbers, in terms of number of cases, ongoing death rates, hospitalizations, we're doing quite well. I think that's because we put a very hard initial emphasis on getting high-risk folks vaccinated, and that went very well. If you look at our 65 and over population, we're one of the leaders nationwide. And since those are the folks most likely to have severe disease, most likely to be hospitalized or die of the disease, I think that's paying off. And so I think from a numbers standpoint, we're doing well in terms of this actual COVID-19, which in the end is what's most important. But clearly, we have work to do on vaccination. Our vaccination rate is not where we want it to be. We certainly do not want to stay at 42nd.
When I look at the southern states, it seems that we're doing pretty well compared. Is that?
We are,
okay.
yes, because the other southern states are also down in the
All
30s
right.
and 40s, unfortunately.
Because I see the North Carolina,
Yeah.
the Georgia, the South Carolina numbers regularly.
Yeah, so if you're looking at like Georgia, South Carolina, North Carolina, Tennessee, Kentucky, the states right around here, Alabama, Mississippi, we are better than most of those. But again, not nearly where we want to be and not good enough. So we have more work to do. I've told the team they've got more work to do. We're not satisfied where we are. We're certainly celebrating the successes we have, and that's really the very good numbers on disease state. But we've lost almost 9,700 South Carolinians to COVID. That's an absolute tragedy. I do not want to see that number go over 10,000. And I think if we keep our current trends, we probably won't, but that's very important to me. We don't want to lose anyone else.
What incentives are you doing to get people who normally don't do these kinds of activities?
Well, like I said, we have the brewery, we have the state parks. The state legislature looked at some larger incentives. Just yesterday, when they were looking at the House Ways and Means Committee was looking at the finance bill, there was a proviso to start a lottery like some states have. That failed. There was also at one point earlier on a proposal to give college scholarships, which some states have done. That also failed. We've looked at that. I don't think we have the legal authority to do a $1 million lottery, and I'm not sure we'd want to anyway. But we are certainly looking at alternative incentive potentials and working with some of our partners on that to see, what we can maybe partner with private industry that they could offer the incentives working with us. And that's how the breweries are doing it. That's a joint DHEC Brewers Association campaign, and we're certainly reaching out to other retail groups to see if we can do some of those things. We will have a week of COVID service starting June 13th, and we're partnering with many of our providers, pharmacists, doctors, hospitals, and they're each going to have their day when almost every pharmacy in the state that has vaccine will be giving free vaccine, no appointment required. We'll have a hospital day. We'll have a faith day where faith-based groups will be encouraging individuals to get the vaccine either at their worship service. The worship leader, pastor, priest, whatever it is, will be encouraging the use of the vaccine. And then we're also working on a day of service, which a couple of other states have done very successfully, where we're actually going to encourage volunteers and train them up to go door to door, or at least, or talk to their friends, their neighbors, people they know. I mean, I don't expect them to not go out the door cold, but, talk to people they know who have been vaccinated and do some education about how to talk to folks about the vaccine, give them the information they need, and get them to go out and encourage folks to get the vaccine. We think if someone you know, someone you trust goes and asks you for the vaccine, that's going to be much more effective than if I or Keith or Dr. Traxler, smart as we may be, or not, but, it's much more effective, I think, if someone you know talks to you better than someone you don't know. So those are all things that are coming. So some of those are incentives, some are not. But I think we're using incentives to the degree that we can with our legal authority.
I thought that's all where one
Yes, sir.
of the educational areas had encouraged bonuses for teachers to
Yes.
be vaccinated.
Yes.
Have you seen, is that being done?
To my knowledge, no. I know some private companies are doing that here. So some private companies are, including, I think, some of our hospitals. And we're certainly fine with that. We encourage that. But I'm not aware, now there could be a school district that's doing that and I'm not aware of it, but I'm not aware of anywhere in South Carolina that's doing that.
What's, in your experience, what incentives can be done and where are the incentives most effective?
I think the incentives, number one, are most effective when they are things that people want, when they target the populations that are having the lowest rates, which for us is mostly young folks. And when, I'm not sure that necessarily large cash incentives are most effective. There's not a lot of studies with COVID, but looking at other health campaigns where incentives have been used, large cash bonuses don't seem to help all that much. It's interesting. There are other incentives that people respond to better. I can tell you one that we're certainly encouraging and I think would be very helpful is that businesses gave people time off to get the vaccine. Basically sick leave or what do you want to call it. But hey, if you go get the vaccine, we'll give you today off and we'll still pay you. I think if we can encourage businesses and others to give people paid time off to get the vaccine, and if they have a side effect that keeps them out of work for a day, they don't lose that day. I think those sorts of things actually go a long way. Again, making access very easy. And again, I think then the incentives of, things that encourage people to do things because others want them to help. So again, I think when we can find things like going to the bar, for lack of a better way to put it, but when we can find things where people are going out with friends and the friend says, hey, let's go get vaccinated. Actually, those kinds of things have been shown in the past to be very effective. So,
You're kidding.
No, I'm serious. If you look at the literature, there's evidence that when people go do things in groups, they're more likely to do them than if we try to get them to go out on their own.
So my 30-year-old, I need to pay him.
At the 30-year-old rate, very likely, yes, sir.
Okay.
Yes, I will tell you that about 35 and under is our toughest group. Yes. So yes, the 30-year-old, something to encourage that individual would help. Yes.
All right.
Yeah, also, suggestion.
Yes, please.
Could DHEC make a statement that coincides with the CDC as far as racism, where they stated that it is a serious public health threat? And I think that will go along with the African American community, because so far, as far as I know, DHEC hasn't made a statement, and that will mitigate some of these health disparities, and there will be it would address the distrust with the vaccines.
Sure.
That would definitely go along.
Yeah, kind of along with that, I was wondering about I see the age categories. What about the rural? Is that where our struggle is, rural, or is it?
It is, and I think there's multiple parts to it. It's certainly a rural issue too.
Right.
One is simply access, right? It's for some of the rural folks that they don't have good transportation, and the nearest vaccine site is 30 miles away. That doesn't work.
Right.
That's why we're trying to get these mobile units out into the rural communities. Rural communities also, not always, but sometimes are more conservative. We know that there are studies that suggest that folks who are very conservative politically are less likely to get vaccinated. Unfortunately, vaccination has become somewhat politicized in some communities. So that's a challenge. And I think the third thing with folks in the rural areas is simply getting the information out to them. It's easy to put, we have these big signs over I-26 and I-77 about the FEMA site that we had, the CBC vaccination site at the mall that just closed yesterday. And that was a very successful effort. We had more than 20,000 people get vaccinated there. We're very pleased with that. And then when we asked folks, when we asked folks, how did you find out about us? How did you find out to come here to get your vaccine? The number one answer was those signs on the interstate. I was surprised by that. But it was. So the signs on the interstate was the #1 marketing tool we had, right? But that doesn't work if you're not driving on an interstate, not driving by billboards, whatever it is.
Rural's going to be education and availability.
Yes. Well, I also think rural is going to be direct person-to-person contact, calling those
You
folks.
got to get there.
Yeah, we calling those folks, knocking on their doors. I think, and that's why I really am pushing this part about the
Faith-based.
mobile clinics, the mobile parts, the day of service, because I think for the rural folks, direct contact, person-to-person contact, which could be by phone, could be in person, that's what we need. And I don't think we can rely on internet or chat or social media. So we can use all those things; those are fine tools, but that's not going to get us most of the rural folks. So that's why we're really pushing the direct person-to-person contact for the folks who are more rural. So to answer your question, sort of get back to yours, I absolutely agree, and we can certainly work on that. I can tell you we are working with Bishop Green from the AME Church, and they've been very supportive and very helpful, and working with their congregations, because we know that, especially in the rural areas, there may not be a lot of infrastructure, but there's always a church. There's always a religious institution of some kind that many people go to. And if we can reach out through that, and if that spiritual leader tells his flock, you need to get vaccinated, that's very powerful. So we are certainly working through that. We're working through various different types of messaging, but certainly I agree with what you've suggested. We can do that.
Thank you.
You're welcome.
Does money work?
To a degree, but it takes.
I'm talking about me to my son.
Oh, well, your son better than me.
Well, yeah.
How much money are
There
you
is a
offering?
price.
Yeah, there is a price. I'm sorry. Who's on the phone?
Rick, we can't hear him.
Can you hear me now?
Yes.
I was just going to say that one other aspect of this recruitment of people to get vaccinated, I would think would include the volunteers. What we found, several successful efforts, was that when neighbors were vaccinating neighbors, or when DHEC or somebody who's sponsoring a clinic needed volunteers to do staffing, we got more people to come in for shots. So when you work with the churches, you can work with the churches from the standpoint of we need parishioners to come and staff our effort. It tends to make people connect much more, and it certainly creates that confidence you talk about when it's your neighbor who's sitting there across from you checking you in for your shots. So any ways you can recruit volunteers so the community takes ownership, I think is beneficial to your numbers.
Good idea. Thank you. We will. I think we've been doing some of that, but we can certainly enhance it.
I think our success is really working against us as far as infection and hospital deaths, and this will be hard to overcome.
Yes. I mean, and there is a certain amount of why do I need to get vaccinated now? The crisis is ebbing, certainly.
A lot of positive
A lot of positive news.
information in the news.
So it's a little bit of a double-edged sword. I'm still glad the numbers are going down. Let me emphasize that. But that does take some of the edge off of the need to get vaccinated for some folks. Especially if you're young and healthy and you say, well, looks like the problem's going away and I didn't get vaccinated yet. Maybe I don't need to. So there is a challenge there. And we're trying to encourage folks to say, well, just because it's down now doesn't mean it's going to stay down. There are other variants out there, some of which are looking worse, but the vaccines still seem to be effective for those. You don't want to get one of those, So we are certainly trying to overcome that. But you're right that the success we're having on the disease side of the equation is probably impacting our vaccination rate.
Dr. Simmer, if we're in the 40% as far as vaccination, those who have had COVID, does that take it to in the 50s, 50%? Is that only 15% of our population?
Probably between 50 and 60% with immunity, yes, sir. We don't know for sure how long having the disease confers immunity. That's still being studied. But certainly I think we should consider the folks who've had the disease as being immune for some period of time. So that probably gets us into the 50s to 60s, yes.
Do we have any indication of those who have vaccinated who may have also gotten COVID after they were vaccinated?
We do. There is now
I know it's
low.
Results is
I can tell you nationwide, out of 100 and now I think about 70 million vaccines that have people who've had at least one vaccine. About 500 people have died of COVID in that cohort. So that's about 1 in 400,000, as I recall. So it's about 1 in 400,000 after vaccination will still die from COVID. So that's a very small number. It's still too many, but and obviously no vaccine is 100% effective. That's true for other vaccines too. But there is certainly a chance of getting COVID after vaccination. It's certainly well less than 1%, which is actually remarkably good for compared to
And
most
most are
vaccines.
mild.
And most of the cases are
Are
mild.
mild.
Yes, they are. They are not requiring hospitalization. They are not requiring intubation, thankfully. So even if you do get the vaccine, the disease after vaccination, it tends to be much milder than if you weren't vaccinated.
Right.
Any other questions?
If I could go just cover a couple of other things. Obviously, our agency does things besides COVID, which, again, that has certainly been our number one focus, but we are working numerous other issues. We are the new Indy paper mill that we talked about last month. So far, they are in compliance with our orders. We have not received an appeal to this point. I believe they are still in the window to do so, but that's closing quickly. But so far, they've been working with us, making progress. The environmental team is doing a fine job of getting monitors out in the community. You may have seen the article in the newspaper about that, so that's going well so far. But so far, I think we're making progress there and working with the company to address the problems and clean up the issues that have been making life very difficult for the citizens up there. So that's making progress, but there's still much more to do. We're still obviously monitoring very carefully. There's still a number of other steps they need to take per both our order and the EPA order. So we are tracking and we'll keep you updated on that. We talked last month about long-term care facilities and their reporting of visitation. I will tell you this past, 2 weeks ago, I sent you a note saying we had some pretty concerning numbers. This week, I just got the numbers. They're much better. We've gone from, I think, 85 not reporting down to about 35. So that's certainly a positive trend. Still, we'd like to see less than that. But the numbers are much better this week, so we're encouraged by that. So we'll continue to track that. The good news is that almost all continue to be open for visitation. We are currently working with other state agencies in the governor's office to determine what data will be needed going forward now that the emergency order is over. So I don't have a definite answer on that, but we are looking at that. We do anticipate over the next few months that we will be decreasing the frequency and number of reports that we release, but certainly still tracking very carefully disease rates, hospitalization rates, so that there would be a blip for some reason, we immediately know it in response. We're not going to stop, our vigilance or our tracking, but we are going to decrease the number of reports that we release as other agencies have less need for them. But we'll certainly keep you all informed both of those changes and of if we do see any change, any negative change in the COVID numbers.
Well, I'm glad the numbers came down because I kind of felt like that might have been a oops week with Memorial Day on Monday, even though I'm sure we gave them till Tuesday from what I understand. But I'm glad to see the numbers came down after that spike.
Yes. Good. So, last time, I'm sorry, go ahead. Greg?
Yes, sir. I had one comment with regards to these citations that are being issued. I was curious when I saw the list that we had, and I talked to several of the institutions who were being cited and asked them why aren't you filing the report? And invariably there was some story associated with it. For example, in one case, the person who was accountable for providing the reports under pressure all this time finally had a nervous breakdown, and so a small organization lost the one person who was responsible for doing it, and they didn't know it wasn't getting done until suddenly they were faced with fines and so forth. And there were stories in others as well. So I encourage the staff, and I know they do this. But I want to redouble the encouragement that they get to the bottoms of the stories, because some of the stories are certainly legitimate enough, at least at first blush, that there should be consideration on these fines. And if you wish, later I can call you and give you an idea of where I talked and what was said, and perhaps we can have another look at it.
No, yes, please do. We would appreciate that. Again, I think the numbers are trending in the right direction, both in terms of the visitation, but also in the reporting. I'm very pleased this week. I do agree last week seems to be a 1 week blip. How much longer we'll need to require reporting, I'm taking a look at with our team. So this may be a fairly short-term issue, but more to follow. But again, I
Yep.
think right now the numbers are looking pretty good.
Okay, thank you.
And last, we continue to work on hurricane preparation. We did a virtual coastal tour with the governor and other agencies on Monday, meeting with the 9 emergency management departments at the counties, the 9 counties that are in the coastal region. I think we're well set for that. We have our list of emergency shelters. You may have seen that we have now partnered with inpatient hospice facilities to serve as emergency medical shelters. And basically, an emergency medical shelter is just one that has an emergency power supply. So we don't provide medical care there. But if you have something that needs a power supply, an oxygen generator, or some kind of medical equipment, you have a pretty guaranteed power supply there because they have a secure generator. Since many of our inpatient hospice facilities have that, they've agreed that if they get evacuated or if they have space, they will serve as medical shelters, many of them. So that's been a big plus for us. That increased our numbers.
How large are those? Do you know the average size of an inpatient hospice?
I do not, but I'll find that out for you. Yeah, I don't know for sure what the average
I generally
size is.
think they're smaller in size, but
Yeah, they are, I think.
so they'd probably accommodate some. I've just been through several evacuations, and it's awful for those that have to be evacuated.
Yes.
At the places that the sheltering that they have to go to, a lot of times are hotels and motels, and it's just real tough on particularly on elderly to do that. But it's necessary. I know I've been through several. It's necessary, but I appreciate the effort of trying to find locations because it is difficult.
Because normally we do have more than 1,000 EMS emergency medical shelter beds. Because of COVID precautions, that number is down to about 650, so these inpatient hospital beds will help. Now, the good news is we've never used more than about 130. In the worst storm, we used 130. So I think even in the 600s, we're fine. Obviously, if a Category 4 or 5 storm, heaven forbid, would hit us, then all bets are off. But I think for the kinds of things we generally see in South Carolina, we're very well prepared. We have now finalized the draft order that we were working with the hospitals that I told you about last month, that they will be allowed to retain some core staff if they feel it's safe to do so, so that they can reopen at least their emergency and urgent care sections immediately after the storm. Because as much as we tell folks to evacuate, we know they don't always. We want to have medical care available, and also for first responders who have to stay behind and may get injured during the storm. There will be a source of medical care very quickly after the storm, which we think will be a positive change. Because in the past, the hospital evacuated all their staff, and then they couldn't reopen until the evacuation order was lifted because those folks were not exempt. So now we will exempt some folks like that to stay in the hospital building. They'll have to obviously identify a safe space, have food, water, all that for them. But the hospital has indicated they do not think that's a problem. They're very ready to do that. So I think that will be a positive change. And then the other thing, obviously, we're also putting together what we call ready teams this year for hurricane response. Everything from folks from our environmental side. So if there's a dam that's possibly even damaged and we think might breach, if there's a sewage treatment plant that's been inundated, if there's a hospital that's been damaged, and we need to get our folks, our subject matter experts out there very quickly to look at them, they'll be on call and ready to deploy as soon as the storm is passed on a moment's notice. And that's something we've done some things like that before, but I think this will be a little bit bigger scale and a little more organized, so that counties will have that resource ready to go on a moment's notice if they need it. So I think from a hurricane standpoint, we're as ready as we can be. We would love to have a season like last year where we didn't have any, keeping our fingers crossed. But if we do, we're ready. The last thing is we do have both testing set up at shelters, so that as people come in, they can be tested. And we will have vaccines available for them as soon as the storm is passed. We don't want to give we don't want to deal with giving them the vaccine as they're coming in because that's kind of a chaotic time. And if they have a reaction, then we got a problem. But as soon as the storm is passed and we have medical support, we will offer them vaccines before they leave. So that, sir, is my report. Pending questions.
Any questions?
No. Sound like you've been busy to me.
You've got a great team. It's been a lot of work.
Don't let them fool you.
We'd just like to congratulate you on surviving your first 100 days, by the way.
Thank you.
Yeah.
Okay.
You've really done a fine job.
Thanks, Rick. I appreciate that.
Any other last questions before Bentley gets up? Okay, Bentley, come on up.
Good morning, Mr. Chairman, members of the board, Dr. Center, and council. My My name is Bentley White, and I'm the Director of the Office of Policy and Communications and Healthcare Quality. I'm up here today to present the healthcare quality administrative and consent orders issued during the reporting period of April 2021. During the month of April, healthcare quality issued 2 consent orders totaling $7,500 in assessed monetary penalties and 50 notices of violation and civil penalty totaling $19,950 in assessed monetary penalties. I'm happy to take any questions at this time.
Any questions for Matt? That was from when? What date was that?
April.
April.
Really, on the second one, Mulberry Park, you may be getting there, if I'm ahead of you, I apologize, but could you elaborate on failing to ensure the resident safety and that the client was protected from abuse?
So we received 2 complaints alleging an incident involving staff members and a client that resulted in the client having bruising on their face. So it all relates to the incident, and there's video surveillance that we were able to review and with staff interviews. Does that answer your question?
I think so, yeah, thank you.
Any other questions? Okay.
Thank you.
Thank you. Rebecca, how you doing?
Good. Good morning, Mr. Chairman, members of the board, Dr. Simmer, and council. I am Rebecca Sproles, liaison for environmental affairs. During the reporting period of April 1st through April 30th, 2021, the Office of Environmental Affairs issued 11 consent orders with total assessed civil penalties in the amount of $47,980. Also reported during this period were 10 administrative orders with total assessed penalties in the amount of $65,461. I'll take any questions you have.
Refresh my memory. With your assessed penalties, where does that money go?
It depends. It's usually 50% goes to the general fund and 50% goes back to the county.
Waste of money to me, but is that required?
I believe that is in a statute, but I can follow up on the exact amount. So
Yeah, I'd like to talk to you about that.
Okay.
I think it'd be better used than put it in general fund. I just had a question on some of that. This is just a general comment on some of these that we're looking at. They are in compliance and they paid the fine. Should we even be having those in here? I mean, if they've paid the fines and are now in compliance, should the staff be required to put this in here? Is there a reason why?
As far as public record, but
But
we may have an opinion.
It's up to y'all what you want, what information.
if I'm reading through these and I said they've done everything they're supposed to and they paid the penalty, I'm going, okay,
So you saying
I'm saying if they've,
not to list?
based on staff's opinion, if they have met the requirements and they paid the fines, I don't know that they need to report that to us. Does anybody got a problem with that?
I think the disclosure's healthy, myself.
But who are they disclosing it to?
Public, to us first.
I know, but
First to us, I guess, to make a challenge and question.
if they've done everything they're supposed to?
I mean, if there may be issues that we have regarding any of these actions that we can challenge staff. As a matter of fact, we can revoke the decision of the staff. Again, my feeling is this is purely a part of disclosure to not only first to us, but also to the public.
Sonny, the question I had that I'll ask is 1, 2, and 6. These are, I'd say, repeat offenders, but it's not their first violation, right? So I'm not sure if this answers your question, Sonny, but or do we have an educational process with them, or are they just constantly not in compliance, or what happens in those
There is a
scenarios?
level of education and these are underground storage tank orders. And sometimes in the underground storage tanks program, there are just some bad actors, if you would, that we have trouble getting them in compliance, but we do try and work with them as much as we can. And which is why you see several repeat orders. Some of these are just, we just keep continuing on to work with them. And they'll do a little bit along the way, but we continue to work with them.
Are you tired of working with them?
I can't answer that.
But see, like, they're still, I guess that they're not, they look like they've got, some time, like June the 12th, I guess. They've got some time to still, comply.
Mr. Kenny, I don't want to talk you out of your argument because I think it's valid.
You're not talking about an argument,
is it,
I'll continue to argue, but I just didn't know,
Is it discretionary or is it?
That's what I said, is there a reason?
Well, everything we're providing here is public information anyway.
Yeah, that's what I'm saying.
This is for y'all to
For our review.
consider, and of course, your board package is also made public in the interest of transparency. But it is all public information anyway. And as y'all know, over the past year, when you've asked us to provide more, we have, and so.
Yeah, usually the only thing I know since I've been on this board, we've asked for is an update. Is this been updated? And the ones I've looked at look like they have been this time. I don't see any weren't. But any that are in compliance, I've never had a question asked by anyone on this board about something that says they paid their fine and they're in compliance. Because that's our objective. That's the objective of the state.
Well, there were some questions that we would ask periodically with regards to whether there were repeat citations
Right.
or things of that nature. And I think that's maybe part of the way that the report has been enhanced with additional information. So we've had
If it's a
what I call a
repeat
good response to all the requests.
Yeah, if it's a repeat offender, I agree.
I'm happy with the report.
And then, under the Bureau of Quality, there was one where it looked like we had, let's see, where is that number? Number 9, A&E Electric. And the update on that was on February 4th, the department determined that the individual entity is exempt from permitting requirements. Could you explain that? We went after them, and then we said, well, we shouldn't be going after you. Is that what it was?
And it turned out after a review that they were exempt. And just to explain a little bit why they were still fined, and that's because a facility can be exempted, but they still have to comply with certain opacity limits and other requirements to maintain that exempt status. The facility was not maintaining and operating the control device correctly, which did result in a 74% opacity violation. So that, in essence, is what they were fined for. So we did determine they were exempt.
So
They still have to be.
they were at
They
one
still
point
pay
exempt, but because of their conduct, they lost the exemption.
No, they are still exempt. We have determined they're still exempt, but they were in violation of their opacity. So we fined them for that, and they have corrected that issue.
Because they're not exempt.
They paid their fine, or that?
Yes, they have paid
Okay,
their
so
fine.
they have paid their fine. So they're exempt, but they're still required to meet the regulatory.
Yes, yes,
So Rebecca,
Well,
would it be fair to say
I
they're not exempt from that particular issue?
correct.
All right, any other questions? Anything from you?
No.
Thank you.
Thank you.
Appreciate it. All right, what's next?
Five, it's the number public here.
Oh, showtime.
Alex. Come on down.
Let me just open the public hearing. We'll now have a public hearing pursuant to code section 49-5-60 in accordance with the Administrative Procedures Act for the proposed designation of Santee Lynch's as a capacity use area. The following procedure will be used for the hearing. A member of the DHEC staff will describe the proposal. At the conclusion of that presentation, any member of the public may comment. I'll first comment on those who have signed up to speak. At the conclusion of their comments, there will be an opportunity for any other members of the public to speak. Please limit your comments to 5 minutes, and if several members of the group are present, please appoint a spokesperson for the group. Please state your name and organization for the court reporter. Please limit your comments to material that is relevant and is not repetitive of statements already made. If you have a written statement, please provide a copy to the court reporter. Alex Butler will make the staff presentation.
Good morning.
Good morning.
Dr. Simmer, members of the board. We are here to propose the Santee Lynch's capacity use area designation. Presentation today will cover a bit of the background, what the capacity use program is, the timeline of this proposed area, a little bit on the geographical and hydrogeological setting, reported water use that's in the area, current groundwater levels in the proposed area, some potential impacts and management strategies, and then we'll have a little bit of a summary at the end. So just a bit of background on what capacity use permitting is. Capacity use permitting happens in one of our 2 water quantity programs. So we have the Groundwater Use and Reporting Act, which has been in place since the 1970s. We issue permits in designated capacity use areas of the coastal plain for users that use over 3 million gallons in any month. 3 million gallons in any month is about an inch of water per week on 28 acres, or about what 1,000 people would use on average in a month. Outside capacity use areas, users are still required to register and report their use to us, but they are registrations, not permits. We also have the surface water withdrawal and permitting program. It's been in place since 2012. We also issue permits and registrations statewide over 3 million gallons in any month, and all registered and permitted users report to us, but they are 2 separate laws, and they're very different. So just keep that in mind, that the groundwater program is different than the surface water program. On the groundwater side, we do have this legislative declaration of policy. So the General Assembly declares that the general welfare and public interest require that groundwater resources of the state be put to the beneficial use to the fullest extent to which they are capable, subject to reasonable regulation, in order to conserve and protect these resources, prevent waste, and to provide and maintain conditions which are conducive to the development and use of water resource. The important part here is highlight that we put to the beneficial use to the fullest extent to which they are capable. So we often get criticized for telling people they can't have water, but our directive from the legislature is actually the opposite of that. We're directed to put this resource to the fullest extent possible to beneficial use. The statute lays out that groundwater capacity use area designation is appropriate where groundwater withdrawals present a potential adverse effect to the natural resource, pose a threat to public health, safety, or economic welfare, or pose a significant threat to the long-term integrity of the groundwater source. This action can be initiated either by the department, government organizations, or groundwater withdrawers themselves. In this case, it is the department that's initiating the action. We do have existing capacity use areas in the state. The first one was designated in 1979 for Georgetown and Horry counties, largely due to the growth of the tourism industry, lots of water use associated with that, the concern about saltwater intrusion into the area. We added the Low Country in 1981. Again, it was concerns about saltwater intrusion into the aquifer. We actually do have active saltwater intrusion into the aquifer on Hilton Head. Hampton County was added to the Low Country in 2008. We added the Trident, Berkeley, Charleston, and Dorchester County in 2002 due to a large cone of depression in the area. We'll talk about cones of depression. But that was a response to that drawdown in the water levels. Similarly, in the PD in 2004, we had a large cone of depression around Florence that initiated that action. Our most recent one was the designation of the Western Capacity Use Area in 2018, which is kind of the sister capacity use area for this side. It's similar geology, similar concerns. The proposed counties we're looking at are Richland, Kershaw, Chesterfield, Sumter, Lee, and Clarendon counties. This map, you can see the fall line indicated. The fall line is just where we go from igneous metamorphic rock to sedimentary sediment. So this is where the groundwater is, which is why this is where the capacity use areas are. Again, we started with the groundwater evaluation. These counties are lumped together because they act as part of a whole system. This is called a potentiometric map. I think of it as a pressure surface map. So groundwater moves perpendicular to these contour lines. The system up here acts as kind of one part of a larger system, which is why these counties are lumped together. The timeline for the proposed Santee Lynches actually started back in 2004. The state water plan that's published by DNR recommended that the entire coastal plain be designated past use area. So designation of the Santee Lynches would complete that recommendation from DNR. In June 2020, the department released our initial assessment for the 6-county area. That assessment was published online. In January 2020, we held 2 virtual public meetings. They were virtual due to COVID. We did record the meetings and place them on our website and open them up for public comment. We want to make sure everybody had an opportunity to comment if they weren't able to attend the meetings at the time. In March 2020, we published a notice, should be March 2021, apologize for the error. March 2021, we did publish a notice in the state register for this meeting. The comments we received after the outreach comments we received were from the South Carolina Farm Bureau. Received comments on February 10th and March 9th. Those are in your board package as attachment C. Just a summary of those comments, the Farm Bureau was concerned that the length of the permit was too short. We do a 5-year permit with a 5-year renewal. That is laid out in the regulation 61-113, so that's kind of outside the scope of designation of a capacity use area. The staff feel that the 5-year permit allows us to be flexible, so we don't have to do draconian cuts. Later down the road, we can make short-term adjustments, make small adjustments, so we don't have to make harsh adjustments later. They were also concerned that the groundwater permitting structure didn't take into account the unique nature of agricultural use. The department reviews all applications based on the intended use of the applicant. So if you're an agricultural use, we review it as an agricultural use. And what we're doing is we're looking to make sure that the use of any user is not going to have a negative impact on existing users or the system as a whole. So that's the goal. We do evaluate each one based on their intended use. They also requested that the DM board take at least 2 weeks between this public hearing and a formal vote.
Why?
I'm sorry?
Why?
For additional written comment.
They're here to speak, so they can answer.
Oh, okay.
Just a little bit about the geographical and hydrogeological setting we're working at. So the 6-county area, you can see the population breakdown. Majority is in Richland County, obviously with Columbia, smaller amounts in the other counties, Sumter being the second largest county. We do see population growth throughout the area. If we look at kind of the land use map here on the left, you can see we have urban area around Columbia, a little bit of urban area in Sumter. We have large agricultural areas in Lee, Sumter, and Clarendon County, and kind of more open land in Kershaw and Chesterfield. Our surface water resources in the area, we have Congaree River, Wateree River, and the Lynches are kind of the major water bodies that we have available, surface water bodies available. Groundwater in the coastal plain of South Carolina is in a wedge of sediments in the coastal plain. Kind of up here near Columbia around the fall line, it's a very thin wedge of sediments, tens to hundreds of feet thick. And by the time we get down towards Charleston, we're talking about thousands of feet in thickness. So, and that's divided up into aquifers and confining units. Aquifers are just units that are permeable, allow water through them, kind of think loose sands, gravels, that sort of thing. Confining units are tight clays that prohibit the water or slow down the water movement between the units. Up towards the fall line, where the proposed Santee Lynches is located, the aquifers and confining units are highly variable. They're in size by river valleys. The confining units don't have the same lateral extent that they do once we move towards the coast. So it operates kind of so differently than you might have seen for issues that happen along the coast. There's also just less available water for drawdown. You look at this image, you can kind of see we're at the shallow end of the pool here. That's how we like to refer to it. The aquifers are very productive, but there's less available drawdown in the aquifers themselves. Counter that with what we like to see towards the coast, where we have deep units that are separated by the confining units. We're also concerned about saltwater intrusion along the coast. It's obviously not a concern up here near the fall line. And we're also concerned about concerned about land subsidence near the coast. Yes, sir.
Just curiosity, how are we able to determine where the aquifers split? I'm seeing maybe 2 aquifers that have split
Yeah,
from single to dual.
Yes, sir. The hydrological framework is put out by DNR. They do that by taking core samples. So they'll drill a core out, pull those cores up, and describe them if kind of here. So we can see when they take those core samples, if it's a aquifer, we'll see sands and gravels, that sort of unit. If it's a confining unit, we'll see these tight clays. So that's published by DNR. They do update it and modify it fairly regularly. So some of the names I use today, if people are familiar with groundwater, they might not be the same names you heard 5 years ago. So they do change that quite a bit. Again, up here in the proposed Santee Lynches, we are kind of in that wedge of the sediments. Is there a question?
Well, I think some of them
So we have the river valleys again have been sized through the aquifers and confining units. What this means is there's just a really high connection between the surface water and the groundwater. So if we start using the groundwater heavily, that can have impacts on the surface water flows. We can reduce flows, especially in our small tributaries. This has impacts not only to the natural system, but also just other permitting aspects of DHEC. NPDES permits, for example, are based on 7Q10, which is a low flow metric, which can be reduced if we reduce that amount of groundwater that's going into the system. So that can have a big impact on other permitting programs statewide. This area in the proposed Santee Lynches is also an important recharge area for the aquifers across the state. So if we think back to that last wedge map, those aquifers extend from the fall line all the way to the coast. The majority of the water is going to enter in the recharge areas. That's those areas where the aquifers are exposed to the surface, which is largely located in the proposed Santee Lynches area. So we have recharge areas for the Crouch Branch and Queen Branch aquifers. Those are the primary aquifers that are utilized across the coastal plain. The recharge is a function of climate. So we also have to be considerate of the climate that we live in and how that affects the recharge. This is the graphic on the left is just a long-term precipitation index to kind of give you an idea of wet and dry periods. You can see extended dry periods in the 2000s, almost 2015. You go back to the 50s, we had a dry period. But we do have these extended dry periods. When we have these extended dry periods, the amount of water that's entering the system is reduced. The images on the right, one on the bottom is a low recharge year. Much of the state received little to almost no recharge into the aquifer system. And you can compare that with a wet year where we had almost 20 inches of the rainfall was infiltrated into the groundwater system. So the amount of water that's entering the system is out of our control and is driven largely by climate. The existing groundwater use and the proposed Santee Lynches, again, users should be registered with us and reporting water use to us. So